This next conversation is going to be really sweet. Okay, we're just going to be talking about diabetes, but it does have a lot to do with sugar. First, let's understand what's going on in the body when somebody has a diabetic condition. When we eat food, our body breaks the food down into sugars that can then move throughout our blood. Insulin helps move the sugar from the blood to the cells, where it can either be used for fuel or stored for later. So the relationship between insulin and sugar is a very important one. For people with diabetes, they either don't have enough insulin, or the insulin's not working right, or a combination of both. An A1C test can tell someone on average what their blood sugar has looked like for the past 2 to 3 months. Usually people that are being monitored for diabetes will have this test twice a year. The test results are not a one-size-fits-all, but for most people, the results need to be less than 7%. A normal reading is 5.7% or less. Now that we've talked a little bit about what diabetes is, next let's talk about medical emergencies that could take place in the dental office. The person's blood sugar can either be too low, which is hypoglycemia, think O, low, or hyperglycemia, where it's too high, like hyper. If the patient is conscious, we'll notice more of these symptoms that can differentiate between the two. For hypoglycemia, some of these symptoms will include sweating, maybe looking pale, feeling hungry, a lack of coordination, feeling sleepy or irritable. They may even say they feel drunk or confused. Our response to hypoglycemia is giving the person simple sugar. The simple sugar that we would administer for hypoglycemia can either be glucose tablets, which we would administer 3 to 4 tablets, or the glucose gel. The instructions for use for the gel is to consume the full content of the tube. Wait 10 minutes. If there's no change, then to consume another tube of the glucose gel. The American Diabetes Association also recognizes the consumption of 4 ounces of fruit juice as an appropriate dose of sugar in the case of hypoglycemia. Now, the symptoms for someone who's conscious with hyperglycemia is going to look like maybe even like they look sick. They've got abdominal pain and vomiting, an acetone odor on the breath, weakness, headaches, blurred vision, dry mouth, dry skin. Remember, with hypoglycemia, we saw sweating or moist skin, frequent urination, and increased thirst. The concern here is diabetic ketoacidosis. When you don't have enough insulin and your liver has to break down the fat into ketones, but it does it too fast for the body to handle, resulting in a buildup of ketones that essentially poison the body. This can result in the patient falling into a diabetic coma. Diabetic ketoacidosis, or DKA, is a very serious situation that requires medical attention in a hospital. An EMS response needs to take place if this is suspected. If a patient with known diabetes falls unconscious, it's hard to tell whether it's hypo or hyperglycemia. And we can't have them consume sugar orally to see if that resolves the situation. The emergency drug for a patient that's unconscious is going to either be dextrose, which is administered intravenously in the vein, or the administration of glucagon that can either be in the form of a spray or delivered intramuscular with an injection. Glucagon is a hormone that raises the blood sugar glucose. Like with most medical emergencies, we're going to still administer oxygen and record the vital signs. For a better understanding of diabetes, you can visit the American Diabetic Association at diabetes.org.